2 days after the sacking of striking registrars and interns working at the country's referral hospitals, the Kenya Medical Association has condemned the act, saying the move only served to deteriorate an already severe situation. This was the same position held by the Kenyatta National Hospital, who regretted that the patients have been made to suffer over a situation that can be talked through.
The persons or the people who are punished by this are actually innocent patients of this country. And therefore my call is that there are so many ways or avenues really that can be taken to bring this to an amicable solution.
We wish to take this opportunity to further advise the government to rescind the mass sacking instructions immediately, to avert any more distress to patients, and to give room for constructive dialogue. KMA further wishes to state that no one should be victimized based on the aforementioned issues.
Dr. Eli Nyaim, the national chair of KMA, noted that even at training level, registrars offer the bulk of services within the health facilities and therefore they should be treated better.
Doctors and health workers in this country work for very long and unpredictable hours because of their few numbers and the unique circumstances under which they have to work. We therefore feel that it is very important to give them a fair hearing when such differences arise.
But the Kenyatta National Hospital has a different view regarding the working condition and remuneration of trainee doctors.
The minister and our ministry has put it very clearly that the reason why they are not paying the self-sponsored registrars that allowance is because they are not employees of central government, neither are they employees in the public sector. And therefore, the issue of discrimination between government-sponsored registrars and self-sponsored registrars on this allowance should not really arise, because the allowance of extraneous and call allowance is actually payable to all doctors in public sector in Kenya.
So far, the strike and subsequent suspension of the doctors has serious impact on the Kenyatta National Hospital's outpatient clinics. And although Dr. Richard is assuring that all KNH doctors are on duty and working around the clock, KMA says the government should be held responsible for continuing suffering of patients.
We've even gone further to recall those who are on leave and others who have been on other assignments outside the hospital, and they are all on duty, trying to alleviate the pain and suffering of our patients.
We must also blame the government for getting ourselves into this situation, because every time you sign an agreement and you trash it and you don't move forward, the crisis boils and reaches a bursting point. And that's exactly what is going on. The doctors had things that were discussed, were agreed on, were signed. Nothing was implemented. A lot of it has not been implemented. The teacher is the same. The lecturer is the same. And that's why all these things keep on recurring. That's why I'm saying the bottom line is that the government needs to be honest when they're discussing with people, so that we don't sign things for the sake of signing and then you trash it immediately and don't move forward with it.
Dr. Eli Nyaim, though reserved, said that if the crisis continues and the government fails to act accordingly, the doctors will have no choice but to down their tools in solidarity with their suspended colleagues. Josephine Wawera, GBS.